Well, I think a lot of the time when it comes to breastfeeding, women have privacy concerns. Some women are very scared how they're going to cope taking their breasts out in public. How are they going to be able to go out and have a life again? How are they be able to feed in front of people? And I really just want to stress that there are many ways of working around this. So if you are planning a trip out and you need to breastfeed, perhaps look for shopping centres that have a bathroom that is designated for breastfeeding moms. And there are many that do have that. Take a shawl with you or a breastfeeding wrap, and that is usually very, very discreet, and you can put that around you. When you're going out with friends, perhaps just surround yourself with people who are close to you and understand that breastfeeding is completely normal and that the baby needs to feed. If you're going back to work and your workplace is perhaps not very breastfeeding friendly, you could chat to the people at work and see if they would consider putting in a breastfeeding friendly room or allocating a room. In actual fact, you are protected by law to be allowed 2 breaks at work to go and express. So some moms are afraid that if they breastfeed, they won't be able to continue, or how will they get milk to the baby if they go back to work? For those moms, they can easily purchase a hands-free breastfeeding pump, and they can perhaps go to a private room and express during their work time to still maintain that breastfeeding relationship and keep their supply up. Some moms are scared that they won't be able to eat certain foods or enjoy their life anymore or go out. For those moms, I really want to say that breastfeeding does not require any special diet. It may be wise to just cut down a bit on your caffeine, your very spicy foods. They could upset the baby's tummy a little, and certain foods that are perhaps safer to have in small amounts, but in general, everything in moderation. You don't need to cut back and have a special diet. We would advise moms that if they are going to have a drink, that perhaps they breastfeed the baby first, and then they can have their 1 glass of wine. So it's no problem if they'd like to socialize and have a glass of wine. It's perfectly safe to do so. We are not encouraging moms to drink, and we absolutely are not saying you can drink a whole lot of alcohol and it won't have an impact. But 1 glass of wine is considered safe. Your nipples, surprisingly, have absolutely nothing to do with how successful you breastfeed. What can make a difference, though, is if your nipples are very inverted, you may very well need assistance, professional assistance, to either help to latch the baby or possibly use a device. There is a very valid reason for using a nipple shield, even though through time with lactation specialists, it's been given a very bad rap. It can help a mom to breastfeed her baby, and whether you do it with a nipple shield or not, you're still breastfeeding. It doesn't make a difference. The only thing you need to be aware of is that with the nipple shield, there could be a slightly less transfer of milk. So we would aim to slowly transition off the shield if possible. But small nipples, big nipples, funny looking nipples, I've seen it all. And moms can breastfeed with the right support. The babies don't nipple feed. They breastfeed. If they can get as much as possible in their mouth, that is the important part. And if they're able to swallow and their mouth is working well, the tongue is working well, there's no tongue tie, lip tie, muscle problem. If the baby is able to fit that nipple in the mouth, sometimes the fit is not quite what you'd like it to be. A very, very large nipple with a small baby's mouth can be challenging. We may need to look at other options just till we get through that phase. And there are many options. You must never feel despondent if you can't get the baby onto the breast. And if anyone's rude about your breasts or nipples, you need to get another care provider. So anyone who looks at your boobs, they're not clairvoyant, and they say, oh, your breasts, these are too small, or these are too big, or these nipples don't look right, you need to get another practitioner. There's no such thing as too small, too big, nipples aren't right. Everyone can breastfeed with the right support. There are a few % of women who can't. And in those instances, of course, with professional help, when they find out they can't, it's totally understandable. They've tried their best. But yeah, and there's no preparation for nipples. A lot of people seem to think they have to strengthen them, toughen them, roll them, put them in the sun. We risk sunburn putting them in the sun and drying them out. We risk damaging them. We risk all of these things. The only way we know if someone can breastfeed is to breastfeed. When the baby's born, we find out. And if it's not working out, we get a lactation specialist in. This is an excellent, excellent question, and most of the moms do worry that their babies aren't getting enough milk. There are 3 things to look at. The first is that the baby's picking up weight. And usually I recommend that my moms have a weekly clinic check, or just pop down to their baby clinic. If they have a lactation specialist, perhaps a home visit, but they should, in the first 6 weeks, check the baby's weight weekly. The baby's picking up weight? Excellent. The second thing for moms and partners at home, if they're worried that the baby's not getting enough, is to look in the nappy. The babies who have fed well usually would have really good nappies in between feeds. So if you and your partner are very, very worried that the baby's not getting enough, just change the nappy. If you see wee or poo, that's an excellent sign. And the third thing to look out for is a baby who's content. And a baby generally that's fed well and is growing well is going to be fairly content in between feeds. A lot of babies do have an element of reflux, and this is something that most new parents are worried about. They feed the baby, pick the baby up, and a little bit of vomit comes out. Small amounts of positing, little bits of milk that comes up, absolutely normal, nothing to be concerned about. I would suggest that moms, after feeding, perhaps hold their babies upright for a little bit of time and avoid this heavy jolting motion that they tend to like to do, because you can imagine if the tummy's full and that little valve at the top of the tummy that leads into the esophagus is open, the milk's going to come up very, very easily. So it is often a concern. I would only be worried if the baby is vomiting up large amounts after each feed and not picking up weight well, and of course unhappy, because that can be quite uncomfortable for the baby, and the throat can end up being quite burnt and red. In those cases, you would need to see your pediatrician. So if it's excessive and not picking up weight well, definitely a pediatrician needs to be consulted. No, you don't. So the reason I say no, you don't, is some babies will POSIT because they're full. And in that case, you don't want to add and exacerbate that condition. So if the baby does bring up a little bit of milk, there's no reason to feed again. No, they don't. This is a great question. Babies do not always need to be burped. Some babies will feed beautifully, be so happy and content and fall asleep, and it seems quite sad to wake them up to burp them. It is not true that a baby has to be burped after every single feed. So you need to read the cues. If your baby is pulling their legs up and looking uncomfortable and almost looking like they're stressed, it's a very obvious thing that perhaps they do have a wind. Some people will say their lip gets very tight, a little bit blue, and their face grimaces. In those cases, you would want to wind your baby, but you don't have to routinely do it. Babies need to be fed little and often. The average newborn will feed 8 to 12 times in 24 hours. The first 6 weeks, you do need to make sure that your baby's feeding minimal 8 times in 24 hours. And you need to make sure that the latch is correct, that someone in the hospital has come around and checked it, and a good latch is crucial to good breastfeeding. When it comes to being on the breast, probably the most common question that I get asked is, how long should the baby stay on the breast? Well, each baby's unique. We do not have a set answer for this. Some are gourmet drinkers, some are snackers, some are really, really slow and enjoying and savoring the feed, and others are just efficient and get it done quick. What's more important is that you watch your baby swallowing and you watch that your baby has a good seal, that there's no air escaping when they're on the breast. And when you're watching the baby feed, that you actually can hear often a soft sound of the milk going down. So if you are concerned about if baby's feeding enough and for long enough, just check the nappies in between. If there's good nappies, they're usually doing well. And in terms of how often, once again, the reason they feed often is because babies digest breast milk on average in an hour and a half. So them wanting to feed is not being spoiled or naughty or, gosh, I've got a strange child. It's completely normal for a baby to feed 2 to 3 hourly. This is a fascinating question because the evidence is out now that growth spurts don't really exist. It's more a developmental growth. And what we've been teaching for many years is that those growth spurts that occur at 7 to 10 days or 2 weeks or 3 weeks are not really a growth spurt. They're just the baby's needs at that point to feed a bit more and to be more alert and to be more with mom. So yes, you may well find a period of time, anything from 2 to 3 days, or should I say 48 to 72 hours, where the baby wants to feed little and often, sometimes on, off every hour, and that's completely normal. It's fine to do that. It's nothing wrong with the baby and nothing wrong with your milk supply. In actual fact, the research has shown that the more a baby drinks, the more milk they obtain. So if your baby wants to feed often, this is excellent. Offering both breasts is very important. However, there are times when the baby would feed on one side, and if that does occur, I would allow them to finish the feed. In other words, not a short time on that breast, but to allow them to get a full feed, and then perhaps in between you can wind them, change the nappy, and then offer the other side. So it's always good to offer the other side, but if baby doesn't take that side, then you would start with the side that you didn't start on previously, or you would start with the left if you fed on the right with the previous feed.